In today's video, I'm going to talk about the amazing power of acupuncture for Bell's palsy. In my practice since 2003, I've seen it over and over how amazing acupuncture is for Bell's palsy. Acupuncture is often the only safe, natural, effective way to treat Bell's palsy, especially if we can see the patients right after they've been diagnosed. The earlier, the better. Hi, I'm Clara. Welcome back to my channel. And if this is your first time here, I create Chinese medicine and acupuncture content for students and practitioners, making it easy to grasp and fun to learn. Let's do this. Today I'm going to share the Western view on Bell's palsy, including believed cause, symptoms, and treatment. Then we'll dive into the Chinese medicine view, pattern, causes, and treatment, including acupuncture points, food, herbal formula, and so many more treatment options. And stay till the end because I'll have 3 simple strategies you can give your patients to do at home to add to your treatment as well. I don't know if you have seen a lot of patients with Bell's palsy, but I have over the years, and the amazing outcome from acupuncture is something that we can't take for granted. And we need to continue to educate the public on this option because a lot of people don't know they have this option, and often the doctors may not know neither. So the more we can put the word out there, the better for the patient, the better outcome for them, and so the better the world, right? So when it comes to Bell's palsy, the Western perspective causes is not quite known. Often they will say it could be coming from a dormant viral infection like the Epstein-Barr virus or the herpes virus or any kind of virus that's been dormant and kind of got activated, maybe because the immune system got depleted, there was a lot of stress. They're not quite sure. So the main symptoms of Bell's palsy, it looks kind of like a stroke or post-stroke. It happens on one side of the face. And what happens is the patient loses feeling and sensation on that side and the muscles start drooping. So there's drooping of the eye, sometimes drooping of the lip just on one side. The eye sometimes can't close and has to stay open. The eyelid is not able to close. There's also sometimes pain from the facial nerve that gets activated. Fatigue, headache, tinnitus can also come up from those symptoms. For some patients, there will be ear pain, jaw pain as well. This whole one side of the face will be affected and it can create headache that goes all the way to the back. And the solution to it is to wait, and often it will resolve on itself between 2 to 6 months, which is a long time to live with this condition. However, for some people, it does not resolve at all. So this is really important to try to help the patient as fast as possible, right? That makes sense. When it comes to Western treatment, there's not a lot of options. Physical therapy, corticosteroids, or antiviral medication is what patients have access to. This is why we know acupuncture is such a good tool. It's safe, it's effective, it's fast, and it has no side effect. So it's the best way, right? So today we're really going to dive into the Chinese medicine view on this and how we can treat patients as effectively as we can. So now let's talk about the Chinese medicine perspective on Bell's palsy. Causes-wise, we look at the fact that there is a long-standing amount of stress that depletes the immune system. So it's basically wood in the 5 element, really insulting the metal, or liver insulting lung, depleting the immune system, right? And then if there is an internal pathogen that's been sitting there for a while, it kind of reactivated. So it's really an immune system depleted by stress, which is often what the Western medicine is saying. And then the pattern, or what happened, is there's external pathogen wind that invades the body really quickly. And within 48 hours, there's a quick change. And now the person has half of the face, or hemiplegia, paralysis, looking like paralysis on the side of the face. So external pathogen wind is what creates this condition. And then eventually it becomes internal. So we need to treat it as soon as possible because it is still external pathogens. Make sense? So that's the cause and the symptoms and the main pattern. Now I'm going to look at each pattern, what point we use, what formula, what are the symptoms, so we can differentiate and do a really good deep dive into acupuncture treatment. So let's talk about the 2 main common patterns when it comes to Bell's palsy. As you can see, the first one is more of a deficiency type, and the second one is more of an excess type. They both have wind because that's the external pathogenic wind that starts the whole process. So the first one, which is spleen chi sinking, is rapid onset of mild weakness to total paralysis on one side of the face, occurring within a couple of days, right? When it comes to spleen chi sinking, remember it's going against gravity. It's dropping down. So facial drooping is very much one of the main symptoms, specifically also eye drooping as well. There is difficulty in closing the eyes or smiling, not the eyes, the eye, because it's usually on one side of the face, or smiling because one side is drooping as well. So it's very hard to have or to make facial expression. The person is also drooling. There's excess saliva because when there is spleen chi sinking, there is spleen chi deficiency prior to that. So there usually is excess fluid because remember, spleen is in charge of water metabolism. So there's also sometimes a loss of sense of taste. The person's not hungry. They have really poor appetite. They're exhausted, very, very, very fatigued. They have loose stools, pale face, pale tongue with teeth marks, which is really a sign of stress. You know, when people are stressed, they have tendency to clench their teeth. And then eventually we get teeth mark, and that depletes the spleen because the spleen gets fatigued. The pulse is weak, specifically in the middle right position, which is the spleen position. When we compare this to blood stasis with wind, the same thing happened at the beginning, which is the external wind invasion. There's a rapid onset of total paralysis on one side of the face, which is occurring within a few hours. So this one's a little faster than the first one. And then there's going to be facial drooping. And same thing, difficulty in making facial expressions, such as closing the eyes or smiling. Now, the one more symptoms that's different from the one before is because there is blood stasis. Remember, blood stasis in TCM means purple and pain, the two P's, right? Purple and pain. So there's got to be pain, and usually it's a stabbing pain around the jaw, behind the ear, and around the head area, which basically creates a bad constant headache. And it affects the side of the face that's obviously being affected by the external wind invading the body. So it's really sensitivity to sound as well. Everything light and sound gets really amplified, right? The tongue is purple. The pulse is choppy, wiry often because it is due to, again, stress that created or activated the condition. Yet another masterpiece. Thank you, Clara. This is one of the feedback I got on my Chinese Medicine Treatments Made Easy book, which covers over 160 common syndromes. It ships all over the world, or if you'd rather have the PDF, it has a lot of video links to complement it. It is absolutely one of my best books, and it's so useful in clinical practice for students and practitioners. Click the link below and get your copy today. So when you look at the points that are for spleen chi sinking, we have to raise spleen chi, raise the energy back up. So we're going to use spleen 6 for that, Ren 6, stomach 26, and do 20. It really raises the energy. And if you feel like the person is a little cold, then you could add up Moxa on those points, right? Then we are going to do points that are specifically for the facial area. So Ren 24 and Do 26 are going to be on the chin and above the lip. So to start, really activate the muscle around the mouth to get smiling possibility. And then we are also going to do points that are all around the area affected, like the stomach meridian specifically, like stomach 2, 3, 4, 5, 6, right around the jaw, the eye, and the mouth. Stomach 7, which is right below the zygomatic arch, which often there's a lot of pain there. Stomach 8, also really useful specifically because it lifts energy and it's good to address the facial nerve. And gallbladder 3. So you can use any point on that area that you think would be the best suited for your patient. Sanjiao point can be used as well. Sanjiao 23, which is at the end of the eyebrow, can be used. Gallbladder 14, if you think there's a lot more that can be done, you can put more. This is just a basic, right? Makes sense? Okay, so now let's talk about blood stasis. Blood stasis, obviously, we want to move blood, we want to move chi. So the first point is Li4 because it's the commander point of the face. It has to be there. It commands the face. right? This is the most important point. It is going to command the treatment. Also Sanjiao 5, because it goes behind the ear and it goes around the eye area. And this is a really good point when there's lots of stagnation, specifically on the face with lots of pain. Now, stomach 45 is great to bring the energy down, because usually with blood stasis, all the energy is up at the top with all this pain. So we want to bring it down to the foot. You can add up other points if you want, like liver 3, gallbladder 34, that I often add for purpose of moving blood. And then we want to do the same thing for the face, right? You pick the points on the face. As you can see, those are exactly the same point as the pattern above, and you can choose to add more to it, less to it, depending on where the area that's affected is most prominent, right? This is really local point that you can use. So that's pretty simple. We want to raise the chi, or we want to move blood stasis, and then we want to go where facial area is. Make sense? Awesome! So we did all the points, and now we want to do electroacupuncture to add to our point prescription. Often with electroacupuncture, I will do stomach 7 and stomach 8, or maybe stomach 6 and stomach 4. You can put also both, right? 2 different prongs. So with E-steam, I will usually do very low setting. We don't want to be sharp and strong. We want to be very gentle for about 10 minutes of the treatment. And then I'll take it off and leave the patients with another 20-25 minutes with the needle. I think that works really, really well. E-steam is really helpful in getting circulation and activating the nerves. The second treatment option is ear acupuncture. I love ear acupuncture. It's one of my favorite micro systems because it works so well. And in general, I'm going to use points like the cheek, the jaw, the ear. You could use the eye, you can use the lips as well, and then shenmen. And you can put ear seeds on your patients so they can activate and acupressure those seeds while they're away in between treatment. How often do I see patients when it comes to Bell's palsy? Usually I try to tell the patient that it'd be great to come at least twice to 3 times a week, depending on the schedule and what can be done for them, but at least twice, not less than that. 3 times a week would be much more effective or faster. 2 times a week still works quite well. In my 20 years of practice since 2003, usually for most patients, it takes about 4 to 6 weeks to get everything back to normal. For some patients, it took less than 2 weeks because they came right away. And that's the power of the internet, because everybody is more educated now, or they look it up and then they see acupuncture and they start getting immediate assistance and support, which that's the best outcome for us. Another treatment option is Moxa. It's really good to use Moxa. You can show your patients how to do it on the facial area, just around here, to get some heat, and Moxa 10 minutes every day would be really, really good to bring circulation and to help the process of healing much faster. The next treatment option is Gua Sha. I love Gua Sha. I think it's underutilized. And what I do when it comes to Bell's palsy is I will do Gua Sha on the facial area that's affected prior to needling for about 10 minutes to really activate the muscle and get some movement and circulation. Then I will needle, do some E-steam, so for 10 minutes. So we'll get a lot of activation there. And then for the last 20-25 minutes, I'll let the patient rest and the patient's body ability to self-regulate on its own with no stimulation. Now, one of the things we don't talk often for Bell's palsy is food or nutrition, which is kind of odd to me because the digestive system is at the center of our health. This is really important. So we want to have food that boosts the immune system so our body can fight and improve circulation and healing, right? That's what we want to look for. So what do we recommend patients to add to their diet and to avoid? In general, add up seeds like sesame seeds, pumpkin seeds, which are great in zinc. Reishi mushrooms are great to add up. Blackstrap molasses is a good one. In general, we want to avoid as well to eat processed food and food that create internal wind or excess wind, like eggs or shellfish or pork. So that's for the food perspective. So we haven't talked about Chinese herbal formulas when it comes to Bell's palsy. However, there are some formulas we can use in conjunction with everything else. However, I think the physical therapy like acupuncture, auricular acupuncture, and everything that we've talked about is really very effective. When it comes to spleen qi sinking, one of the patterns of Bell's palsy like we talked earlier, the best formula is Bu Zhong Ichi Tong, which means tonify the middle and raise the chi. It's a really good formula. The main king herb in that formula is Huan Chi, which is astragalus. And astragalus is really good in boosting the immune system and raising energy. So that's a good formula for this. The other one is for blood stasis. So if there's blood stasis, there's tons of formulas for blood stasis that are going to be really useful, like Tao Hong Suwutong. Tao Hong Suwutong is really good when there's a lot of pain and it'll move a lot of blood, so that works quite well as well. However, the formulas are not going to be enough or the most important part of the treatment. The physical one is the most important part, like Moxa, like Gua Sha, like E-steam, auricular acupuncture, and specifically acupuncture itself. Facial massage can be used as well. At the beginning of this video, I talked about 3 strategies you can tell your patients to do at home to speed up the healing process in between sessions. We talk about ear seeds, Moxa, Gua Sha, they can do all this at home. However, wearing an eye patch is essential to give the eye a rest. Also, hydrating eye drop will help because the eye will dry so fast if the lid does not close. And one more thing is to find ways to meditate and de-stress, relaxation method, because all this starts with an amount of stress that created the depleted immune system. So it's really important people or patients found ways to meditate and de-stress. Those are 3 strategies I think you should recommend to your patients because they work really well. I've seen it in the last 20 years of my practice. Have you seen this replay of the live video on acute pain and acupuncture? Watch it. It's one of my most popular ones. Thank you for watching today, the power of acupuncture for Bell's palsy. If you have any questions, leave them in the comments below. And if you found this video of value, please share it with others and subscribe. That's all I'm asking of you. Lots more on my website. Enjoy, have a fantastic day, and no matter what, keep rocking it using TCM.